Hello, I am Dr. Sujoy Dasgupta, consultant in reproductive medicine from Genome Fertility Centre. Now, probably you know that March is celebrated as the Endometriosis Awareness Month. So, we'll discuss about couple of questions regarding endometriosis. The first question is, what is endometriosis and how common it is? Before understanding endometriosis, we have to know what is meant by endometrium. Endometrium is basically lining of the womb or uterus. Because of some hormonal interplay, the endometrium is shed, and this shedding is called menstruation or period. Now, for some unknown reasons, in some women, this endometrium may be located outside the normal location. That is, it may be located around the ovaries, it may be located around the foot pipe, around the passage of the urine passage, or other parts of the tummy, and this is called endometriosis. What happens? Every month, this endometrium, which is not located in the normal position, it also responds to the hormones. As a result, during menstruation, there is bleeding inside that abnormally located endometrium. As a result, there is bleeding, and this bleeding causes two problems. Number one, it can cause some cyst formation, which is called endometrioma or chocolate cyst. And number two, it can cause adhesion, that is abnormal attachment between different organs. That is, it may cause abnormal attachment between ovary, uterus, foot pipe, the ureter, that is the pipes connecting the kidneys to the bladder. So this may cause the problem. Endometriosis is common, but unfortunately it's not always properly diagnosed, because some women with mild endometriosis may have severe problem. On the other hand, many women with severe endometriosis may not feel any problem at all. And moreover, many times the diagnosis requires laparoscopy, that is surgery. Therefore, it's not possible to do surgery in each and every woman. Therefore, endometriosis is often underdiagnosed, but it has been found that 1/3 of women overall are having endometriosis, and the incidence may be higher in women who are suffering from infertility, that is difficulty in conceiving. Now, coming to our next question, when one should suspect that she is having endometriosis, and when should she visit the doctor? The common symptoms of endometriosis are pain. The pain may occur during periods, during menstruation. It may occur during passage of urine, passage of stool, or some women may have pain during intercourse, particularly when the penis is deep inside the vagina. And some women may have pain throughout the period. They have pain in the tummy throughout the cycle, that is throughout the month, irrespective of whether they are having period or not. Regularly they are feeling pain. Some women may have other problems like shoulder pain. Some women may have bloating, indigestion, etc. And another problem of endometriosis is infertility, that is difficulty in conceiving. Therefore, if you find that you are having pain, the pain may occur during periods, passing stool, passing urine, or if you are feeling painful sex along with difficulty in conceiving, you may have endometriosis. In that case, you should not hesitate to consult a doctor, and you should not ignore the symptoms. Now, the third question is, when we are going to doctor for endometriosis, what investigations are helpful to diagnose the endometriosis? Number one is, of course, history. As I said, that is, we take the history of pain and what time the pain happens. Then we examine the woman in the clinic. Sometimes we may, when we examine the women physically, we may find some symptoms or some signs of pain. Then we do ultrasound, but remember, rather than doing ordinary ultrasound that is done abdominally, just putting the probe in the abdomen, in the tummy, we can rather go for TVS, transvaginal ultrasound, that is putting the ultrasound probe in the vagina, through which we can see the uterus and ovary in better way, and it can sometimes diagnose endometriosis. Sometimes we may advise some blood tests like CA-125, but remember, CA-125 is elevated in endometriosis as well as in ovarian cancer. Therefore, if you have raised CA-125, Just don't worry. Some women are crying that, oh my God, I'm having cancer. This is not true. CA125 may be raised in various conditions. It may be helpful in diagnosing the endometriosis, but it may be elevated in other conditions as well. Some women may require some advanced imaging like MRI, 3D ultrasound, but the gold standard is laparoscopy, that is keyhole surgery. Probably you have heard the name microsurgery, by which you insert the camera inside your tummy and we see inside your tummy and we can diagnose endometriosis. Having said that, that does not mean that always you require laparoscopy to diagnose endometriosis. Endometriosis can often be diagnosed just by taking history and doing the examination and doing the scan. But many times this scan may not reveal endometriosis. So sometimes you may require laparoscopy. Therefore, number of tests may be required to come to the proper diagnosis. Now, the next question is, what are the treatment options for endometriosis? Before going for treatment options, you have to look into so many things: your age, whether you are planning for pregnancy, if so, how long you are planning for pregnancy, the condition of tubes and condition of your ovaries, how severe the pain is, what treatment did you receive previously, and how large the cyst size is, how large the cyst in the ovary chocolate size, how large it is. If you are not planning for pregnancy, in that case, the best option is to go for hormonal treatment initially. But remember, hormonal treatment will give temporary relief, because when we stop the hormonal treatment, the disease can recur, that is, it can come back. And again, when you are doing the hormonal treatment, you cannot conceive. Therefore, if you are planning for a pregnancy, hormonal treatment is not the right choice for you. But hormonal treatment is very much effective in reducing the pain. And at the same time, you can take some pain relief medicines just to control your pain. If hormonal treatment is not effective, then you can go for surgery. Surgery ideally should be done by laparoscopy, but sometimes you may require open surgery, laparotomy, and nowadays advanced surgery like robotic surgery is also available. Therefore, if you are not planning for pregnancy, you initially can try hormonal treatment. If that fails, then go for surgery. What surgery you can do? Remember, surgery should only be done by the experts, because endometriosis surgery is very difficult surgery. Everybody cannot perform it, so it should be done by some experts. During surgery, first thing we do is adhesiolysis, that is, we separate the adhesions, that is, we remove the abnormal attachment between different organs so that your pain can be relieved. If there is cyst, that cyst can be drained or removed. And if you have completed your family, if you are not planning for pregnancy further, then the last resort is to go for hysterectomy, that is, removal of uterus and the ovaries. On the other hand, if you are planning for pregnancy or you are suffering from infertility, as I have said, hormonal treatment is not the right choice. In that case, we have to see how severe the pain is. If the pain is severe, then you have to go for laparoscopy. By laparoscopy, we can reduce your pain. By laparoscopy, we can improve the chance of natural conception, and by laparoscopy, we can come to know whether you have potential to conceive naturally or you should go for IVF. Remember, if you are going for laparoscopy, immediately after laparoscopy is the best time to conceive. Don't waste time by taking hormonal treatment after laparoscopy. We said that if you can't conceive within 6 to 12 months after laparoscopy, it's better to go for IVF. Of course, when it is the question of infertility, always don't go for laparoscopy, because we have to see your husband's sperm condition, your fallopian tubes, condition of your ovaries. Sometimes we may advise not to go for surgery at all, rather than going for fertility treatment. So it all depends on your condition. The essence is that if you are feeling pain, if you are not planning for pregnancy, initially you try hormonal treatment. If that fails, then surgery. On the other hand, if you are having infertility and pain, then go for surgery. If there is infertility but no pain, surgery will not help. And if there is infertility and pain, but there are any other risk factors like higher age, low AMH, sperm conditions not good, then it's better to go for IVF. Now, how endometriosis affects fertility? It affects fertility in various ways. Number one, painful sex. Therefore, many women tend to avoid the sex. Many women are feeling pain throughout the cycle. Therefore, their quality of life is poor. Therefore, they don't have intimacy properly. Next, endometriosis can affect the ovaries. Endometriosis can cause adhesion, as I've said. As a result, the tubes cannot pick up the eggs from the ovaries. Therefore, fertilization cannot happen. And sometimes endometriosis can affect the quality of oocytes, and that is quality of your eggs and embryos. As a result, women with endometriosis tend to have lower fertility. But don't worry, with treatment, most of the women with endometriosis can conceive. Now, women with endometriosis should go for ART, that is assisted reproductive technology like IVF. If you had previous surgery and your endometriosis come back, it's better not to go for surgery again. It's better to go for IVF. If your age is low or if your age is on the higher side, even after surgery, your chance of natural conception is low. In that case, without wasting time, you should go for IVF. On the other hand, if your partner's sperm condition is poor, then again you need IVF. Remember, surgery will help to improve the chance of natural conception, but surgery will never improve the chance of success after IVF. Therefore, if you require IVF for low AMH, for age, for husband's sperm's problem or tissue block, in that case it's better to go for IVF directly rather than going for surgery. In the context of IVF, surgery is needed only if you have intractable pain or you have hydrosalpinx, that is tubes are swollen. Otherwise, surgery will not help. Therefore, in a nutshell, endometriosis is quite common. If you are feeling pain, don't suffer silently. Just talk to your doctor. There are various treatment options available. Medical therapy, that is hormonal treatment, is for women who are not planning to conceive. Surgery can help you to improve the chance of conception, but before surgery, we have to look for various factors to make sure that surgery will be helpful, because sometimes even after surgery, your egg counts may decline. And IVF is required if you have low AMH, if your age is on the higher side, if your sperm conditions are poor, or your fallopian tubes are blocked. Thank you for watching this video. If you have any further queries, please don't hesitate to contact us through our YouTube channel or Facebook page. Thank you.